My name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome back to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to have a good friend of the podcast here joining us, Matt Eurey, Chief Commercial Officer of Carrum Health. Matt, welcome to the podcast.
Thanks, Norm. Great to be here.
Well, we're excited to have you. And for all of those who may be living under a rock, Matt, Chief Commercial Officer at Carrum. Carrum is changing how we pay for and deliver care through their Centers of Excellence solution. Matt brings over 25 years of leadership in employee benefits, formerly the EVP and GM of the commercial business at Accolade. He was instrumental in scaling revenue from under 100 million to over 400 million, expanding the client base to over 1,000 employers, and guiding multiple acquisitions plus an IPO. Prior to Accolade, Matt held benefits leader roles at Lowe's as well as Time Warner Cable, managing programs for over 200,000 employees. With deep expertise in value-based care, he leads Carrum sales, business development, and go-to-market strategy. Matt also holds a bachelor's in business from the Citadel and resides near Charlotte, North Carolina, as you can see from his Carolina Panthers football behind his head. So, Matt, welcome to the podcast. Excited to have you.
Thanks, Norm. Excited to jump in.
Excellent. So, Matt, you've been in the healthcare space for a long time. You've been, on the buy side and the sell side of healthcare. What inspired you to get into the healthcare field to start your career?
So, Norm, it's funny. I'm not sure I've ever met anyone that as a child said they wanted to be in healthcare. That wasn't exactly where my head was when I was going through school. It's funny how life works. I'm an accountant by training, and so I was actually introduced to the subject of benefits more from the standpoint of I was helping lead some union negotiations for one of the companies that I worked for, and we were going through a pretty gritty negotiation around both healthcare and pension cost. And it was through that exercise that I was asked by a CFO and CHRO, would I have interest in leading a benefits function? And so that's where I was introduced. And I would tell you that that was actually Continental Tire. So that was my first foray into the benefits world. And I'll be honest, just the cost element, there wasn't a big passion around benefits. But what I found when I was into the job and really starting to manage the program, it's a whole lot of fun to try to figure out how to manage benefits within the budget confines that a respective organization has.
Yeah.
But probably more importantly, what value can you provide to the employees to where they actually appreciate the benefits package that you have, that you're meeting those members where they need to be met, and that they're getting the greatest utility. And that's really where the passion was born, and then it was my mission to help members try to do the right thing and be successful.
All right, very good. So walk us through your time leading benefits at Time Warner Cable. Was that right after Continental Tire? Did you have a
It was. So I left Continental Tire. I was the manager of benefits there and went over
How long ago was that? What years are we talking? Approximately, ballpark.
Well, let's just say I didn't have white hair at the time, Norm, but it would have been 2006 is when I started the benefits leadership journey, and then I moved over to cable in 2010.
Well, I'm a big believer in being grateful for what you have. I've got some friends that would just be happy to have hair at all, let alone the color of it. So, Matt, you got to take your wins when you get them.
I'm taking my wins, and I'll just say maybe the white hair is a sign of wisdom is what I'm gonna lock on to. But to the question around running benefits at cable, I mean it was a 55,000 employee life company. We had about 120,000 employees and members on the plan itself. And it was truly a wonderful experience, Norm, really because we highlighted our benefits package as a differentiator to really draw and attract talent to the organization. And so we had really high value healthcare plans. They were more than a 90% actuarially designed plan. We were still one of the companies that had a traditional pension plan that folks were still accruing into. And so from the standpoint of budget, the opportunity to do creative things, to tinker with the system, to learn and try, I was afforded those opportunities. And it was neat because I also had a cool cross mix of employees. I had cable installers. I had those that were working in our contact center. I had executives. And so it was a really fun balance of figuring out how to meet the constituents where they needed to be met for sure. I will tell you just a quick funny story, a memorable moment while leading that organization's benefits. We did a conjoint analysis. And the tenets of a conjoint analysis is to ask employees to make trade-off decisions. Mm-hmm. Like I said, we had the richest healthcare plan. We had this traditional pension plan. The number one valued benefit, I want you to guess what it might be.
Paid time off.
It was actually the free cable benefit that we provided. That brings to light, I would say,
including pay-per-view, or was there limits to this?
There was limits, my man. We weren't doing all the pay-per-view at no cost.
Right.
But you're getting free cable.
You weren't able to watch Mike Tyson on demand.
That's right. But I think it highlights, Norm, what's hard at times is we had really great people working for Time Warner Cable. They were smart individuals, but they couldn't appreciate the value they were getting from the healthcare benefits, the pension plan, and what they really loved was free cable. I think that's what makes the job at times so hard when you're trying to manage benefit programs.
Yep. Totally. I believe when you were an employee there, the Knicks were owned by the Dolan family, and maybe by that time, the Cleveland Indians, now known as the Guardians, owned by the Dolan family. Just curious, did the team get to go to Knicks games, and did you guys ever fly out to Cleveland and were shown the stadiums?
By the time I was there, we'd actually spun off Time Warner Cable from Time Warner, so I did not enjoy, Norm, some of those benefits.
Oh, gotcha. Well, a little joke in Cleveland may be that hopefully, the Dolan family was better with their benefits than how they spend with the MLB team. Sometimes we're on the lower end of salaries, so hopefully the benefits were good. So what is a solution, that you brought on in your time there that really increased, the benefits offering? Was that, free cable? Was that your idea? Or was there other things, and programs that you invested in that really upped the benefits robustness, let's just say?
Yeah, I'd love to take credit for free cable since they valued it so much. That was already in place.
Okay.
But I did care navigation, and I did that through Accolade. I was one of the first customers to ever look at this external care navigation advocacy category. And we were just in a mode, Norm, and I think maybe it was because I was an accountant by training. We just weren't getting the proper utilization. Folks were really struggling with how to navigate the package. It was so rich that they would just make bad decisions. They would go to the ER and do some of those things. And so we were able to bring that in. We actually did a pilot and control at the time where we did half the population on the external care navigation, and we kept half the population on the traditional insurance carrier platforms. And it was as clear as day from the standpoint of engagement through savings, through all facets, that we had uncovered an opportunity to do things a bit differently. And it really started me down the path to know that care navigation was a good solution.
That's great. Were there any solutions that you were pitched in those years at Time Warner that you passed on or didn't have the ability to implement that later you realized, like, wow, that company actually did great work and they ended up doing well as a company? Because when you were there, like, that was almost like the beginning of a lot of this like digital health craze.
I'm going to actually not say the name of the company, Norm, so I'm going to protect it, but I will at least say it was a digital therapeutic solution that has just done a really masterful job in market. They're supporting hundreds, thousands of clients at this point. And I'll tell you the funny story, which is the reason I turned it down. I really loved the solution. We were going to implement it. And the CEO of that company went above my head because he didn't feel like I was moving fast enough. Because to your point, it was early stage. All these companies were trying to make it.
Yeah.
And now I find myself on the other side of the table. I'm now in the position where I'm trying to get buyers to look at a solution that I'm supporting. And I chuckle all the time because the single reason I did that was because they usurped what I thought was my authority. And it was really a bad decision because it would have been a value add to the suite of benefits that we were affording.
All right. Talk to me about that transition from you moved on from Time Warner, you went over to Lowe's to lead, benefits as the VP of Total Rewards. Lowe's spends in excess of $1 billion annually on healthcare and covers a whopping 300,000 employees. What was it like moving from a 50,000 life group to a 300,000 life group?
Yeah, you can never appreciate, Norm, and some of those numbers for Lowe's, they've adjusted through the years. That was what they were when I was there. I'll just make that caveat just because I know
Yeah.
the Lowe's organization and have such deep respect for them. But you really have to appreciate that scale and size. Like, I could do even more at Lowe's than I could do at the former because I could be more creative. I could do pilot and controls. I could do trials in different types of organizations within Lowe's. We had bought certain organizations. We had distribution centers. We had stores. We had corporate locations. And so that ability to be creative was ever present when you're running something of that size and scale. You know what's interesting though is that retail, you live and die on a daily basis from how the stores are performing. And so where at cable, we over-indexed on a rich benefits program, we had to be a bit more creative to work within the confines of the Lowe's budget. We had really strong benefits. Our employees had an affinity for the package, but I couldn't go and spend unnecessarily there. There had to be return on investment
Yep.
for those programs. And if there wasn't, I couldn't implement them. And to be honest, those that could get creative with administrative cost and minimize those for me and then make their money either through shared savings or through results, those were often those benefits that rose to the top. And we had a lot of success, driving that at Lowe's.
That's fantastic. I think ROI is one of the most misunderstood, exaggerated phrases in all of benefits. Everyone says they have a strong, hard ROI, but when you really start to look into the details, there's very few that have a hard ROI. Luckily, Carrum's one of them. And we, love that fact. And, there's other companies like One Imaging and others, that we've come across over the years that drive like a hard guaranteed ROI, no cost up front, total percentage of cost savings, utilization based, you name it. But that is the exception, not the rule in this space. So first off, back in your Lowe's days, how did you and your team calculate ROI? And two, which are the groups that you did pick in those days, that kind of beat that level of scrutiny?
First of all, I'll corroborate what you said, which is there are very few solutions these days that deliver hard dollar return. And there are other merits and reasons why you implement solutions. And I'm not here to say that you shouldn't implement a solution that doesn't drive hard dollar return. But, at both organizations, Norm, the things such as presenteeism and some of the softer aspects, we just had to dismiss.
Yeah.
It really was for us, was their return on a utilization base per widget of whatever that company was performing that I could easily point to. And I'll tell you, we had more than 25 point solutions at Lowe's when I was running that program. The bigger challenge for us at times was apportionment. We would have maybe a navigation company that was helping to bring more eyeballs onto a solution. Do they get credit for that? How much credit do they get for that? Versus the company that actually performed the service that was driving that return. And so it was a linear equation of what did you do and did us save us money in comparison to the way that we used to do it? And there was a lot of setup on how we would measure that on the front end. and we would utilize external actuaries to help us measure that, data warehouses, and it was that black and white, and we would see. And when those for us that were not delivering return, we would quickly move on from them. We were a fast fail company.
Yep. Well, I don't want to call out any bad actors, so we'll stay away from the ones that got cut. Which are the ones that stayed? Which are the ones that delivered real value, in those years that you'd like to give some credit to?
I will tell you that the COE aspects, Lowe's in concert with a couple of other, large retailers like Walmart, we were the early adopters of COEs.
Yep.
We saw an opportunity, whether it was cardiovascular procedures being done in a single hospital, whether it was the early days of an MSK or bariatric travel COE program. It was clear as day, Norm, from the standpoint of quality, readmissions, and the bundled pricing that we were down the right path. I will tell you that there was a con to that, though, which is we learned over time, folks don't want to travel. And the piece of it that we got wrong was telling somebody that needed a spinal fusion that they were going to have to get on an airplane. Well, when you need a spinal fusion, the last thing that you want to do is get on a cramped airplane. And so the thing that ultimately attracted me to Carrum was the evolution of the COE space. We figured out a way to build a much more comprehensive network without sacrificing quality. And we made access localized, but still kept the tenets of bundled pricing, the providers having skin in the game and risk. And so that was, to me, one of the single biggest values that we afforded. Secondarily, there was a really big learning for me at Lowe's. When you've got, at the time I was there, we had 1,680 stores.
Yep.
It's really hard to engage and to make sure that you bring awareness to 1,680 stores where emails were not afforded for roughly 50 to 60% of the population. Well, how do you tell them about what to do, how to do, why to do it? So we did things like navigation, but we also met those employees in the stores. We had traveling RVs and buses that would go so that they could know their numbers. And those that had elevated risk or those kind of things, we then were positioning them for outlets of care with our COEs, et cetera, to be able to address those high cost spenders.
Yeah, you were extremely successful at Lowe's. Why did you decide, hey, I'm going to move over to the vendor side, the dark side, as some say, over to Accolade?
It's funny. There's a couple of reasons why I wanted to make the transition. Number one, you kind of hit on something. There are a few solutions in market that I think deliver exponential value. And I was fortunate enough to put a couple of those in, and I had a passion for them. Like, I wanted to be a part of evangelizing their why and to be able to drive more awareness around that. And so that probably was one of the bigger impetus behind me wanting to make that transition. I would also say, and man, I lament, the benefits buyers are still my peers. That's who I still talk with. That's I just have a kinsmanship with them. That job's really hard.
Oh, yeah.
And so for me to have the opportunity to take kind of my learnings of being on that side of the table and deploy it in an alternative way was attractive to me. I liked the challenge, the thought of trying to still stay in a vertical that I had such a passion for, but could I deliver value in a different way was kind of the driver behind that transition.
Yeah, and walk us through all your success, like taking the company from under 100 million in revenue to over 400 million, growing the book of business to over 1,000 employers. Like, walk us through that explosive growth and like what you did right and what you learned from, that makes you a better leader today.
Well, I have to say something though, just for those, benefits buyers that listen to the great podcast that you put forward. There's a funny story, and I'll just tell you, you better be humble if you ever want to flip on the other side of the table. And this is true, and it's the most memorable thing, Norm. I went to Business Group on Health my last year at Lowe's. I was a pretty known guy because I'm old. I'd done benefits for a while, and I walk into the exhibit hall. and I had 26 people surround me with one step into that exhibit hall.
Oh, yeah.
The next year, I was on the vendor side of the table, to use your vernacular, the dark side.
Sprinting in the other direction.
I walked into that exhibit hall and I had one person turn around that was on the vendor side, throw their hand up and say, "Hey, Matt, it's good to see you." If you're not willing to be humbled, if you're not willing to work and chase and go after something, you're going to be humbled and you're not going to be successful. What I found...
I would also say, shame on those other 26 commercial people, because what goes around comes around. Like, if you're only friends and buddy-buddy with someone when they can do something for you, and then the second they can't do anything for you, like, oh, you're like, well, that was all artificial. Like, I was just, doing it for my own, like, motives, let's just say. Like, you remember that. And guess what? Like, maybe you're not a benefits leader anymore at that point, but guess what? You knew dozens, if not hundreds. And when push came to shove, like, if someone needed your help, you're going to help the people that probably were there for you, as opposed to the people that, like, forgot your name, forgot your number.
It's so true. And I mean, I think, Norm, even me and you had this conversation. You never know the person that you're talking to, what role they're going to play next in the benefits space. And so, man, I value relationships. It's not about what somebody can do to help me per se, but I've just found that that person that you're speaking to could be your next boss. They could be the next person that can help you get into an opportunity that's super important. It could be somebody that just plainly needs your help at some point. And so I always have just tried to pride myself on keeping every relationship as sacred as I can, because it just pays dividends to do right by people.
That's the right thing to do.
It's the right thing to do.
So walk us through, okay, you had a rough first MBGH, but you had a lot of success afterwards. Like, how did it go from, okay, no one's returning my calls now that I'm on the other side of the fence, to we added hundreds of customers, hundreds of millions in revenue? What went right?
I'm quick to say, Norm, it takes a village. I had an opportunity to work around just some ultra talented people. I had a leadership team that had sold a company for multi-billion and had a lot of success. And, some of the things that we did get right was we recognized early that it takes a village. Like, sometimes, I think there are companies that believe, let's just get a really talented sales professional and we'll just go and win the market in spades. It's just not true. Like, if you don't have a sales team that's closely aligned with a consulting strategy team that has a great sales enablement function, that's paired with a pre-sales team that understands the solution inside and out in product marketing, we recognize that we're going to win as a team. And we designed the entire sales process to where if you were a lone wolf sales rep, you just weren't going to make it, because you needed to be able to influence, work across multiple verticals. You needed to go and invoke executive support, all of these different things to win deals, especially when you've got a very expensive PEPM price solution.
Yeah.
It just took a bit of a village in order to do that. I would say secondarily, we quickly learned you can never rest on yesterday's message.
Mm-hmm.
If you're not innovating, you're dying. And if you're dying, you're not selling. And so we were always quick to say, hey, what can we package into? What have we recently done that's going to resonate with that buyer? Now, you can get in a lot of trouble. You can go too wide. You can become the master of nothing and the doer of everything, and folks aren't going to buy the solution. But if you're returning value into something that you're good at, and you can talk about that expansion, especially in today's world where there has probably been an over purchasing of point solutions, then I think you can have a lot of success. But it always came back to, how are the pieces and parts working together? And then ultimately, we widened the funnel, Norm. We started with being a jumbo employer slayer.
And then you build.
We then went down market. Yeah, we went health plan. We went government. You've got to expand that funnel if you're going to have that success. You've got to bring the talent in that knows how to do that. And that was some of the secret sauce on the way in which we ultimately built. We also made a couple of acquisitions that fit nicely into the value prop that we were
Talking
affording.
about Second MD and Plush Care.
We did. And that afforded us an opportunity to then go in and share more value to employers to consider. And then we helped to grow revenue in that regard as well.
Yep. Well, you were sold to as a buyer, then you go over to the vendor world and you lead sales teams. We already discussed, like, number one, the worst thing a salesperson can do is just, treat someone a certain way if they serve their interests or not. So that's a big red flag. But what are certain things that great sellers do and the things you look for when you're building a team?
Number one, scrappiness. It may sound intuitive.
Yeah.
I love somebody that wants to make a lot of money being a sales rep. If they want to make a lot of money and they're going to be scrappy to go make that money because of the commission base. And so I just looked for individuals that had kind of a longitudinal record. Those that have hopped one year after another into different spaces, I'm actually not even going to spend time interviewing you because it's a red flag for me. It means that you haven't persisted through something where there's been hard moments. All companies on our side of the table go through those hard moments.
There's no easy road in this world.
There is no easy road. I totally agree and subscribe to that. And so that scrappiness and then that longitudinal experience means a lot to me. The ability to influence, where I've seen individuals that can span verticals, where they know people in the health plan world, where they know their counterparts at other point solutions, where they've got relationships in PBMs and they're well respected and well regarded. They can influence. When you can influence, it just gives you more opportunity to get into opportunities. And then probably the thing that I love is a glass half full attitude. Like
There's so much rejection and failure in sales that, like, if you don't have a optimistic view of the world, it can be very easy to go down a very dark path and get very focused on, oh, this isn't going right, that's not going right, it's all against me, when it's like, no, in sales, like, you control everything. Like, yes, there are certain things that can impact your ability, to perform positively or negatively. But when it comes down to it, like, you can look in the mirror and ask yourself, did I do what I needed to do or not? But a lot of people focus externally when they start going down the negative track.
Yeah, 100%. I mean, like, listen, I want somebody that's polished, that's very excited, but I need them looking around every corner and telling me why they're going to lose something in concert with all that positivity. And if they do that, I know I have a keeper.
Yeah, 100%. What did you learn most from your time at Accolade?
Great question. The customer matters the most. If you take care of the customer, especially in the space that we're in, Norm,
Yep.
Oftentimes your greatest seller is the customer that you're taking care of.
Yep.
And I had
a customer that helped you sell a lot more other customers because they had such a good experience. They were willing to, shout from the mountaintops. Accolade's a great company. They're a great solution. And if you go with Matt and team, they're going to treat you great.
I've got so many of them, Norm. I'm so fortunate that
Right.
some of these companies are still some of my closest friends. They actually turned into friends, and they still call me today, and we still hang out, and I go see them. And even if they're not, some of them are customers of Carrum's as well.
Yeah.
But I would call out State Farm was one of the critical relationships. And I have such deep respect for both Eric and Darcy and just the innovative program that they've built. They've just gotten it right. And I was always the first phone call, if I'm honest. And they would say, hey, I'm thinking about this.
Mm-hmm.
How can we do this? Because they looked at us as the backbone of their overall benefit strategy, and they would allow us to learn from each other. They were willing to be first. And Norm, I'll be honest with you, there are, like a Rick Mays at United is also in that ilk.
Hmm.
But there are fewer and fewer of these innovators that are willing to take that plunge and take that risk. And there's a number of reasons why that's
It's the
occurring. But
biggest mistake in benefits. I went to a recent conference. I'm not going to say which one because I don't want anyone getting angry. But, there were health systems there, there were health plans there was pharma there. There was not any employers there. But pharma, health plan, and health system were all crying foul. The others were causing the healthcare trend to increase. It's their fault that they're not able to do things cost effectively and all these things. But when push comes to shove, health systems are doing just fine with status quo, as are health plans, as are pharma. And guess who's getting raked over the coals? Employers. And until benefits leaders are willing to fight back, then we're going to see more of the same with the 10% increase in trend year over year over year. So, without risk comes no reward. And we need to do a better job, I would say, at the leadership level of Fortune 1000 of giving benefits leaders the opportunity to experiment and maybe make a couple mistakes. But if the goal is progress and, hey, at the very least we tried something and now we know more on the next attempt, I think that's a very, very important thing, because without that support from leadership, you get kind of low risk, low reward decisions.
I totally agree with you. There's nothing more frustrating. And I mentioned State Farm and United and Meta. There was just so many great customers to us in that journey. What would drive me crazy outside of that subset norm is I would tell people constantly, it's your employees, it's your data. You're inviting them into a relationship so you can push them.
Mm-hmm.
And Norm, the fear factor from so many buyers that would say, well, I don't want to push them too hard, Matt. And I was like, why not? Your North Star is to manage your cost and to take care of your people. To me, it's your job to actually go push to deliver the two things that your leadership has an expectation that you're going to deliver. And so it always confused me. And if I have a fear for the future, is who are the next generation of benefits innovators that are going to continue to push the envelope, because the employers actually hold the keys to the kingdom.
Well, they're the only large entity that is, healthcare's not working for them, working against them. And until they do something about it, nothing will change. And we hope that's not the case. So walk us through, you had a great run at Accolade, you sold a ton of business, great customers, great relationships. What was it about Carrum? I think there's probably over a dozen companies in the Accolade, vendor ecosystem. I know Carrum's one of them. Why was Carrum special? And why was that the one, you jumped to?
It really was maybe starting with experience. I knew that value-based care and the value-based care that Carrum was delivering was differentiated. This high-quality bar that we have when it comes to the surgeons, physicians, facilities that join our network, it really is differentiated. And I knew it because they were a partner of ours with Accolade. I'd gotten a chance to know Sach and Brent, the entire team. And I loved what we were doing. And you could see the writing was on the wall that high trend was here to stay. And this very linear equation of we're going to do this and it's going to save you 45% gross savings, 30% net, that's attractive to me as an accountant and attractive to me as a benefits buyer, because it's that easy to look and say, we're going to do that. Probably more importantly was the fact that they had built a service that people love.
Yeah.
Man, you can tell by the accent, I'm a rural North Carolina guy. And my friends are the folks that work in Lowe's stores. They're the folks that work in the cable call center. And I want them to have something as easy as, I just got diagnosed with cancer. What a horrible diagnosis. Your life stops when you get diagnosed with cancer, or your life stops when you're told that you're going to have a spinal fusion. To be able to have a person come in, grab you by the hand, tell you, here's the 3 COEs that you could look at, and here's the surgeons, this is some things that you should be considering. Get them through that entire process in a truncated timeline. And then ultimately, they're not paying anything for the service because buyers waive the co-pays and cost share elements, and then return that value to the buyer. I just believed this vertical and Carrum had the greatest opportunity of impact for the foreseeable future. Secondarily, goes back to they weren't resting on their laurels. We started with MSK, we started with bariatric, but we were bold enough to say you can do value-based care in cancer. You can be bold enough to do it for substance use disorder. Man, what an attractive opportunity. And I just wanted a chance to join and do something that makes a difference. Like it goes, you said it, Norm, there's so much money flowing in this space. It's a shell game. It infuriates me that there's still a lack of transparency around all the dollars that are flowing and who's making that money. We're transparent. You know exactly how much Carrum's getting paid with the bundle. We have a $0 admin fee. We only get paid when surgeries are avoided or when high-value surgeries are performed. It's a beautiful.
The only thing health systems, pharma, and health plans are transparent about is, we're making so little money in Medicare and Medicaid that we're charging a premium to the commercial population. That's the only thing that they'll actually come out and say, okay, facts are facts. Let's address that. Then everything else is just a bunch of unique math, let's just say. I think you're in position to answer this very uniquely. What do many digital health companies do wrong when it comes to benefits selling?
Well, number one,
it's a long list.
There's a lot that they do wrong at times. Norm, number one, there's way too many solutions right now. And there are a large number of solutions that are doing such a narrow thing that they actually don't get distribution right. They shouldn't be selling to employers. They should be selling to health plans or others where they can actually go and get, more users more quickly, just because they're not significant enough to actually have an employer consider them as part of a package.
You don't have enough critical mass.
That's exactly right. I'd start there. Secondarily, it doesn't have return. Just goes back to the days we went through the era. I mean, COVID created an environment where employee experience was the topic du jour.
Yeah.
Employee experience does matter. You want to have something that's attractive. You want a benefits package that folks understand. But if you can't look at a buyer these days and say that admin fee or this service and however you're charging is going to deliver this return, you're not going to get picked up in my estimation.
I couldn't agree more. I have my entire investment thesis based on that.
I think we are entering the days, and we've said it maybe for a while, Norm, and I think you would corroborate this. We're going to have real winners and losers for the first time in the space. I think we're starting to see it. Consolidation's happening. We're going to have some organizations that fold the tent up just because they're not delivering value.
Still at a discount or, something where the outcome is not tremendous for some, and then the winners will be big winners.
I totally agree with that and subscribe to that theory. I think the smoke and mirrors, it takes 7 actuaries to figure out if you're saving somebody money. If you're in that camp, it's just not going to work.
Yep. Any other trends that you're predicting or expect over the next 5 to 10 years in the space outside of just the consolidation and that the gap between winners and losers is just going to get wider and wider?
Yeah, I mean, I do think, we beat that one to death just a little bit by saying there's going to be winners and losers.
Yeah.
But I will also say, man, healthcare is such a millstone around the neck of the U.S. economy. So I don't think innovation stops in our space. I think that there will be the continuation of money flowing into the system like crazy.
The
I think
bar
the
is just so much higher that like companies need to clear than even 5, 10 years ago.
Yeah, I totally agree with that. And I hate at times talking about AI, but I do think AI is going to be transformational, Norm. I do think with certainty, the efficiencies that are going to be born, that will be where there's a great deal of opportunity. I still think there's going to be service orientation. I think a Carrum is going to do super well for a really long time because of what we ultimately deliver. But even a company like us, we're going to gain efficiencies through AI. It's going to prescribe those people that might need a service like ours. It's going to allow us to be more efficient in helping them to pick the right COE. All those things I think are going to manifest.
Yeah.
And I think it's going to change the game of delivery. And I think those that maybe have really high PEPMs and cost a lot, I think a lot of those services are going to get in trouble because somebody's going to figure out a way to deliver that in a much more efficient manner.
Yeah, I agree. Totally. We live, breathe, and sleep this space. Like this is the space we know, we love, all of it. How do you practice what you preach? Any healthy recipes that you recommend that either you or your family make that keep you performing at your best?
Man, I gotta be just an honest guy here. From a recipe standpoint, I mean, I live in the South, man. There's nothing better than some country style steak and mashed potatoes with a banana pudding. And so don't subscribe to my eating habits ever. And like the perfect meal for me, Norm, is a ribeye steak with a baked potato. It has to be a bone-in ribeye. It has to be medium rare.
That's in my past. I used to love those.
But what I do to counterbalance some of the poor eating habits that have been ingrained in me from an early age is, man, I love the water. I love being on the water. And so I'm fortunate enough to be right next to a lake. And so just being out there is super important. And then I love to jog and do some of those things. It's where I go and clear the head and think about what are the next things that we need to be doing as an organization.
All right, we'll get Satya's eating regimen because he's always like pencil thin and always in good health. So
he is a health nut for sure, Norm, and he does a great job.
We'll get the Satch Jane protocol for sure. Well, again, Matt, thank you so much for sharing about your career and all the amazing and exciting things you and the Carrum team are continuing to build. So again, thank you so much for joining us on the Digital Health Heavyweights podcast. And we'll be monitoring your and your company's progress very closely.
Hey, thank you, Norm. Appreciate the partnership and look forward to the days ahead for sure. Have a great afternoon.
Take care.
Take care, man.
Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.